It was a gravitational issue. I mean, everything just started pulling down.
I got tired of looking tired.
Gail and Francine were both looking for an easy way to a younger look.
A lot of people that I had seen that had facelifts looked very phony, and they didn't look real to me.
The thought of going under the knife is really very, very scary to me.
This is plastic surgery, but just the work is done under the skin without scar.
Both women turned to Fifth Avenue cosmetic surgeon Dr. Louis Fetter.
This procedure, I call it the weekend facelift, because we do all that work, and if I do it on a Friday, you're back to work Monday.
It's called the face fill. It's about a 1-hour procedure where fatty tissue is removed from one part of the body and re-injected into your face.
I like the idea that you're sort of recycling something that you don't need in one area and putting it back into another.
There's really no obvious telltale signs of having this procedure done.
That's right. There's no nip and tuck, so there aren't any scars. And the results are still pretty dramatic. Dr. Fetter does the procedure in an operating room in his own office. After applying a local anesthetic, he removes some extra fat from your hips or your abdomen. The fat is then cleansed and treated with a growth hormone and then re-injected into your face.
It's good for the nasolabial depression, it's good to augment the cheekbone area, it's good for areas in here. People get that very deep frown line.
After the fat is injected, the doctor molds it into place.
The sculpting is the most important part to give a very natural, contoured look.
Since the fatty tissue is your own and it's still living, your body won't reject it. And unlike collagen injections, your body will retain most of it for years. So touch-ups aren't as frequent. But if you need one, the doctor is prepared.
I take that extra tissue so I can freeze some extra tissue, and when the patient comes back for a touch-up, we go right to our freezers, we thaw it out, and we re-inject it back into the patient's face. I try to compare this procedure to a balloon. If the balloon loses air, do you put more air in the balloon, or do you pull the skin of the balloon thinner? The answer is obvious. You put more air in the balloon. In this case, we'll put some more fibro-fatty tissue to re-augment that beautiful rose.
This sounded great. It sounded like the least intrusive option.
So does it work? Judge for yourself. Here's Francine before, and this is what she looked like after her face fill.
I wanted to put back what was missing.
Gail went for it too. Here she is before, and this is her after the procedure. So how does fat from your hips feel when it's in your face?
Feels totally like me.
Linda Schmidt, Fox 5 News.